What is cold stress in infants? If you're a new parent or caring for a newborn, you might have heard the term cold stress and wondered what it means. Let's break it down to understand this important aspect of newborn care. Cold stress in infants occurs when they lose too much body heat and can't generate enough heat to maintain their normal body temperature. This is particularly risky for newborns, especially in the first few days after birth. When a baby is born, it leaves the warm and cozy uterus and enters a cooler environment. This sudden change can cause the baby's body temperature to drop rapidly. In the first 20 minutes of life, a newborn's temperature can drop by 2 degrees Celsius to 4 degrees Celsius if not properly protected. Newborns, especially premature ones, have a hard time regulating their body temperature. They can't shiver or use voluntary muscles to generate heat like adults do. Instead, they rely on peripheral vasoconstriction, which means their blood vessels constrict to keep heat in the core of the body, and chemical thermogenesis, where they burn brown fat to produce heat. The main reasons newborns struggle with cold stress include inadequate heat production, limited insulation due to poor muscle development and scanty fat layers, and insufficient vasomotor and pseudomotor responses. Premature infants are particularly vulnerable because their systems are not fully developed, making it harder for them to respond to cold stress. When exposed to cold, the baby's body responds in several ways. The hypothalamus releases norepinephrine, which causes peripheral vasoconstriction and the breakdown of brown fat to produce heat. However, this process consumes a lot of oxygen and glucose, which can be problematic if the baby is already hypoxic or has limited energy reserves. Signs of cold stress in infants can be subtle but critical to recognize. These include pale or mottled skin, peripheral or central cyanosis, respiratory distress, apnea, and bradycardia. Behavioral signs can include lethargy, poor muscle tone, a weak cry, and a weak suck. Preventing cold stress is crucial. This involves maintaining an optimal thermal environment from the moment of birth. Simple steps like drying the baby immediately after birth, wrapping them in plastic to reduce evaporative heat loss, and using warmed, humidified oxygen can make a big difference. Convection incubators and radiant heaters are also effective in keeping the baby warm. In summary, cold stress in infants is a serious condition that arises from their inability to maintain body heat in a cooler environment. Understanding the mechanisms and signs of cold stress, as well as taking preventive measures, is essential for ensuring the health and well-being of newborns.